Hi, please say hello as you're tuning in so I can acknowledge you. Okay, say hello. Let's see. I don't see any comment yet. Just say hello and then we'll just start. I have two people in and we do not have to take any more time. Okay, so how are you doing today? We are discussing a very controversial topic, and I am as excited as you to get this topic started. So, even though we cannot even touch the surface of this topic, but for the sake of awareness and to take away the stigma that people need to be able to do what they have to do to get this thing, to overcome this thing, then we have to at least scratch the surface. Okay, so hello, it's Jezba. that's my number one fan. Thank you for joining. Okay, and I can see your name. That's awesome. Okay, so we're not wasting any more time. We're going straight into the topic. But while you're joining, let me start by asking this question to you. What does consumption of pornography, watching it, what is it to you? Is it like just it's not my business, that might be the person's just harmless pastime, or is it a potential addictive behavior? Or to you, do you think in relationships between a couple, does it spice up their relationship, or is it a relationship destroyer? Does it strain relationship, or does it spice it up? To you, what do you think? Just say spice up if that's what you think, or you think it strains relationship, puts strain, spice or strain. Or perhaps to you, you think pornography is it's not detrimental to one's sexual health. It is actually good for sexual behaviors, or for sexual enjoyment, or for sexual satisfaction. If that is what you think, let me know. Or do you think it affects somebody's mental health? I mean, I know I'm asking a lot of questions, but I'm trying to let us see, different arguments that we get when it comes to this topic of pornography, when it comes to the topic of internet use or regular consumption of pornography, of internet pornography, what we have now. So do you think it's just harmless pastime, it's nobody's business, or you think, it's potentially dangerous and it can be addictive? Or you think, okay, with couples, it spices up their relationship, or do you think it strains it? Or perhaps you think this is just to enhance one's sexual satisfaction, or it is detrimental to mental health. Which one is it? Let me know. So let's discuss. Let me see if anybody is making any contribution. Good conversation. Thank you, Miss Cheryl. I'm so glad you're able to join live today. Awesome. Okay, so what do you think? Just let's discuss this. I want to know what your opinion is so that, this is balanced, because this is a very controversial topic. But let me start by telling you my own experience. I mean, I think the first time I saw this pornographic thing was when I was still, I think, as young as like 7 years old. I saw it in a room of an adult that we just went to visit. And then, the internet, isn't something that we have all over then. We had Playboy magazines, and this person had a stacks of Playboy magazines that I could see, and I started flipping. I was like, what is this? As a 7-year-old or 8-year-old or 6-year-old, you just see all those beautiful pictures. And I was like, wondering, are these real human beings? How can somebody's body be this perfect Oh, they're so beautiful. Something you see, oh my God, you want to close your eyes, but you see it, and that's it. You've been exposed. Okay, good. I see somebody here saying it's detrimental to one's mental health. Detrimental. Okay, Desvar, you're saying, where did I see it at 7 year old? Yes, it's in a place that would be considered a home environment. And I saw the Playboy magazines that the person had, and at some point, you want to go back and see more of the magazine. And I'm saying this because I want us to know that even though we're focusing on men today, I want you to know that there are a lot of children and teenagers that are exposed to this issue we're talking about in an unhealthy way. There's a study that shows that there's a great gap between parents' perception of pornographic consumption by children and what is actually happening. And this study actually shows that of 50%, now I don't have the number of correspondents that they have, but 50% of the children that they interviewed said that they had been exposed to, they had seen, they had watched, or somebody had shown them something pornographic. 50% of children between the age of 11 and 13. And there are groups that I'm in that I see people saying, I started at 8 years old. I was exposed to this thing at 9. I've been involved in pornographic consumption since 11 years old. Oh, my parents don't even know about it, and these children are struggling. So from my own experience, oh, I believe them. And that was even in the days of magazines. Now that almost every child has a phone, a mobile device in their hand that they're watching, it is even more rampant. It is even more rampant. So please, let's just have this in mind as we go forward. So thank you for saying it's detrimental. I also think it's detrimental, and it really is detrimental. For a very long time, at least up until 2018, we have what we call the International Classification of Disease. That what we use, the World Health Organization has that, and it's like a international code, international manual that providers have. Healthcare givers or doctors and those who diagnose different diseases. It's the manual that we have that cuts across countries, the ICD. The latest edition of that actually has compulsive sexual behavior disorder listed there as a disorder. There's still a lot of debate, but we now at least have it in the International Classification of Disease, the 11th edition. ICD-11 now has it as an official diagnosis: compulsive sexual behavioral disorder. The DSM-5, what we use in the United States, which is the Diagnostic and Statistical Manual for Mental Disorders, does not make it a disorder yet. We don't have it, at least in the last edition. DSM-5 does not have that diagnosed, but we have it in the international code. And this is significant because it is even a debate among mental health professionals, among medical professionals. Should we have it there or should we not have it? But here's my take, so we move on. I think it's a good thing that we have it at least somewhere diagnosed. Somewhere where we can say, okay, you have this problem, because it helps with these things. It helps us with research, to help us with prevention. It helps with treatment, because it is not a label. I say this all the time. Any diagnosis that you have, especially any mental diagnosis that you have, is not a label. This is just something that gives us an idea or a guide into how to solve a problem. So having this gives us more reason to do research, more reason to plan how can we prevent it. It gives us a guidance into how somebody can get treatment. So yay, we have a diagnosis in ICD-10. Moving forward, what does this do to our brain and why is it anybody's problem? It is not just anybody's problem. This is something that is affecting millions of people. Millions of people. And I take it from me today. There are so many people around you, family members, friends, colleagues, parents, children, partners, spouses that are dealing with this issue in secret, in their closet, and they need help. They do not know how to go about it because this compulsive sexual behavior comes with one thing. It is a lot of shame. A lot of shame from the stigma, a lot of shame. The shame kills people. You might find people saying, oh, well, I was an alcoholic, but I've been sober for 10 years. I've been sober for 3 years. Oh, I used to be on heroin. I used to be addicted to drugs, but I've been sober for 15 years. I've been sober for 10 days. But you don't hear anybody saying, I am a porn addict, or I am dependent on porn or internet use and I've been sober for 10 days, or I've been sober for 2 years. The shame is that much that people even rarely talk about it. So in this group, my mental health matters, we are not shying away from any topic. We are bringing this to spotlight. And why are we discussing it under the men's topic? Because, well, even though people are arguing that, oh, a lot of women are now into porn, a lot of women are now into the internet porn, a lot of women are now into this. Yes, the number of women now getting into it is increasing, but guess what? We still have double the number of men consuming this, or double the number of men that are battling with this compulsive behavior than we have women. As at 2019, it was still 30%, about estimated at 30% of women to 70% of men. So this is not to shame men. This is not to say, oh, they have a problem. This is for us to agree as a community that we have this problem and our men need help. And as women are also falling into this trap, then it's going to help us deal with it together. So yes, it is time for us to talk about it. It is more common among men than women, even though the consumption among women is also increasing significantly, and that cannot be ignored. Should we go into arguing gender issues? Should we go into arguing women have the right to do what they do? That is not the purpose of this talk right now. This is just for us to talk about it so that we can help those who are dealing with this issue. Okay, so now, if it's a disorder, what is it taking away? And why is it a disorder? And what should we know about it? Well, for it as a disorder, it has to be a persistent thing. People are doing it often. They're doing it continuously, and is having significant impairment, significant distress on the person's personal life, the person's family life, the person's social life, their academics, occupation. There's a study that showed that the HR professionals, they're finding that 2 out of every 3 employees are using work phone. They're using work device or work computer to watch pornography. So even the workforce is being affected by this thing. So when we have something significantly impacting a person's personal life, a person's, and when we say personal, it's taking away precious time that they can use to do other things. It's putting on them the burden of guilt and shame, low self-esteem. It's impacting their sleep pattern. It is impacting even erectile function for men, because we're talking about what does this really entail. It is impacting them in their personal life. That's a problem. Now, social life, people who are engaging in this thing, people who are hooked onto this thing, they isolate themselves. They need a private space. They stay at home. They withdraw. They want to stay in corner. They want to be alone. It isolates them from interacting with people. It isolates them from engaging productively with friends, with family, going out and doing everything, because they're spending hours of their daily time, their daily hours, they're spending it on it. So it impacts their time, and it impacts them in a very personal way and social way. Family, it is impacting their engagement with family members, either with their spouse, with children. It strains relationship. People are saying, oh, well, if a man is consuming pornography, or if a man enjoys it, well, the woman too should just fall into line and do what it wants. No. If you're not in anybody's shoes, you cannot just generalize. There are a lot of women that feel a deep sense of betrayal when they find out that their husband has been engaging in this thing for a long time. You feel you are not doing enough. You feel, what am I missing? What am I not giving you? There's a lot that comes with that. The same too, if you're a man here, just imagine if your wife spent hours consuming this thing instead of spending quality time, intimate time with you, to the point that it even affects some people's, when whatever little time they're going to have for their spouse, they're not able to give anything that is quality, because they are living in a fantasy world where expectations, the sexual expectation, is generally very different, unfortunately. Education, it affects education significantly. In a group where I was listening to teenagers talk about this, I was a boy that said, you know what, I actually dropped out because I could not cope anymore. I stopped caring about academics because all my time was just dedicated to being on website, consuming this addictive addictive images and videos, and I'm just not able to break through. I stopped caring about my academics, and I stopped. And there was this boy too that said, when he was graduating, and his parents saw, the his grades and what he was finally graduating with, parents were like, we're really disappointed because we believe that you had more potential than what you finished with. And he said, if it was before, I would be mad or upset that my parents said that. But this time around, I agree with them because I know that I am performing way lower than my ability. So it is affecting a lot of people. Even for career men, it's affecting their their career, their occupation, because you cannot be productive when you spend a lot of your time, a lot of your thought process is going into, when am I going to get that time to quickly watch a little bit more? When can I get more time to watch more, your mind is occupied with this thing, and you can't seem to focus on any other thing that is productive to you. You can. So what do we do? How can you be a friend? Well, maybe some statistics will help in knowing how much people are watching this and how much time is going into it. one of the popular porn sites, I do not want to mention the name of any porn site. I'm not promoting anything, but one of the popular ones says, they upload about 12 videos of this thing every minute. 12 videos every minute. And they have the number of people watching this thing is more than combining the number of people watching Netflix, going on Amazon to shop, and using Twitter all together. The number of people shopping on Amazon every time and watching Netflix and tweeting combined together is not even up to the number of people watching porn every minute. And in 2019, they had about 42 billion people visited porn sites. So about 115 visits every day, 115 million visits every day. No, this is like really the new drug because people cannot stop consuming it. And if it's affecting every areas of their lives like that, do you think this is something we should trivialize, or something that we should say it doesn't matter, or something that we should say it is their business? Because you're not seeing it, like you see somebody that is drunk or somebody under the influence of alcohol, does not mean that people are not suffering, does not mean that people are not hooked on it. And you say, how did they get hooked on it? What's it got to do with the brain? Here's what it's got to do with the brain. There's a chemical, one of the chemicals that I talk about, where I call them brain blood. I just call them that, the things circulating in the brain to keep them functioning. The brain blood, one of them, dopamine. Dopamine is the one that gives us the sense of fulfillment. It is the reward system. It is the one that gives us the sense of achievement, something you have to do, and then you keep doing it. So how does it happen? So when our brain is exposed to, something, when our brain is exposed and we feel, hey, just like we have, when you want to eat, you think about the food and you're salivating and like, oh, I'm going to enjoy this meal. The sense of satisfaction you get from eating, and you have to eat. Either you're eating for survival, or you're eating for the fun of it. You're eating. You know what comes to you eating something and enjoying it. So when our brain starts secreting dopamine, that gives us that sense of reward, we have ourselves wanting to go back to do more. So it starts from exposure. Like in my case, I'm not sure, maybe if internet was available at that time and I had access to it, because now there's free access. There's free access to the site. Maybe if after that exposure to the magazine that I saw, if it was on the phone and they keep bringing things popping up, I don't know where I would be right now. I don't know if I would have been hooked on it too and needing help right now. I don't know if my perception of sexual intimacy would be the same right now. So that from exposure, you start getting that interest. From the interest, it gets to the point where we have using it to enhance the performance, or to the point of orgasm. Orgasm itself, it brings about more dopamine. And then with more dopamine, you enjoy it. It gets to the place where you build tolerance. So you want more. So a little bit is not enough. 1 hour is not enough. One orgasm is not enough. Masturbating one time is not enough. And you want to do more and more. Tolerance is built. And then what we do, we have repetition. You're doing it one time. 1 hour, 2 hours, 3 hours. Outside in the garage, in your room for 5 hours. You want to be alone, in the car, everywhere. You're doing it because you need more dopamine. And then it gets to a point where you have this intense pleasure. it comes with focus, it comes with repetition, and then you lose control. Then it becomes compulsive. You can't control it anymore. And you keep doing it and doing it. And it's affecting every other thing. And it's affecting every other thing. And then you lose that control. And when you don't have it, you start having that withdrawal. Like, where's my phone? Like, oh my God, can everybody just go to their house and leave me alone? Or would my wife just take the kids to the mall so that I can be alone in the house? Or, oh, will my boss just leave me alone? Can I turn my computer this way so I can quickly have some? And now we have over 80% of the consumption or the watching of porn is on mobile device. Over 80% is on mobile device, either on the phone. I think about 63.3% on the phone, and then the rest on tablets and stuff. So you have it in your pocket everywhere that you're going. So when you see everybody glued to their phone and watching something, maybe they're just watching porn again. Well, the brain is changing. Neuroplasticity, it means the brain can learn stuff and change, and the pathway is reinforced, and it's reinforced, and it becomes difficult to stop. Then willpower is not enough to stop. Then wishing it away is not enough to stop. Then commitment without support is not enough to stop. And it is impacting a lot of people so negatively. Now, there's so much to discuss on this topic. And I told you that we are just barely scratching the surface, because we have issues like children's exposure, internet use, the pop-ups they're using, the economic impact, the social impact, relationship impact, all those things that we have to talk about. Men versus women. How is it affecting marriages? How is it contributing to divorce? How is it contributing to aggressive sexual behavior? How is it contributing to domestic violence? How is this straining relationship? How is it affecting the educational advancement of these teenagers that are now so exposed to it? How is it bringing money to the industry that is perpetrating it? We can talk about the countries that have banned it, but while we can talk about so many other things, I want to focus now on how you can help a friend. Because trust me, there are more people around you engaging in this thing than you want to believe. Maybe your spouse is even dealing with this that you don't know. Maybe you even have a teenager dealing with this that you don't know. Just this week, I was telling my husband about we need filters. We need internet filters because of the kids. Because even while they're watching something, while they're just innocently watching their games or doing stuff, anything can pop up. And guess what I found out? Do you know they even have teams? They have game teams on all the sites. Like they have Minecraft team. Like they have Fortnite team. They have, I'm not sure if they have Roblox, but they have Fortnite. They have Minecraft. They have Pokemon. They have, is it Overwatch? They have all these game teams. And while the kids might think they're just watching game, you never know what they're getting exposed to. So I'm talking to my husband about filters, even for yourself. And those who want to get over this thing has so many steps they have to take. From acknowledging that they have a problem, to discarding all materials that are related to pornography, to clearing their hard drives, to finding something else they can do in their spare time, to putting in password, to asking somebody else to be their accountability partner, to maybe committing to doing it because of their loved ones, or for whatever reason. They have so many steps they have to take, and it is not easy because you can't do it alone. How can you help a friend? I came up with an acronym which is APS. Maybe Adult Protective Service, as we have it here. But here's what the APS is. It's acknowledgement, partnering with them for recovery, and supporting them, standing by them for prevention of relapse and protecting them. Maybe for prevention in case of children, or protecting your friend or loved one from relapsing. That's my APS. Let's talk about acknowledgement. You and I have to acknowledge that this is a problem. Seriously. You have to acknowledge that this is a problem. Because if you don't acknowledge or just admit that this is a problem, you don't want to help. It's just like that was the day my one of the kids around was running away from a fly, like just a fly. I'm like, go sit down. Just a fly. Just take it away or open the door, let it fly out or something. Okay, now if it's a big problem for this person, I do not acknowledge that it's an issue that you're running away from an insect or a bee or something, then I'm not going to help. So if you do not acknowledge that this is a problem, you're not going to be able to help. So when you acknowledge, then you do not trivialize the issue when a friend opens up to you. When you acknowledge, you can even take a step further in initiating a conversation about it if you feel or think or suspect or you stumble upon that this person is dealing with this internet pornography issue, the compulsive use or the compulsive watching of this thing. If you think that it's a problem, you can even ask the person, do you think you have a problem with porn, with watching it? How many times is this affecting you in any way? You can start the conversation with a friend. If you find out that a teenage child or a teenage friend or mentee or a female, a teenage maybe niece or nephew or something, you can just ask them, are you having this problem? Because sometimes you just want somebody to ask, because when someone asks in a loving way, they are most likely ready to help you. So acknowledge that there is something called, or there's something that is called, compulsive sexual disorder, sexual behavior disorder, or pornography addiction, or sex addiction, or aggressive sexual behavior issues. There's something called that, and you can ask. When they tell you about it, do not trivialize it. Another thing, when they tell you about it, if you acknowledge it, please don't run away. Another thing is, do not shame them. It is not a time to shame. What are the obvious signs someone is addicted to or exposed to it? One sign that we see a lot that we ignore is isolation. The person, they want to be alone. And you can ask jokingly or seriously, are you sure? Especially in the case of our children or teenagers, you can ask them about their exposure, because we have to start discussing with them now. All the kids are on their phone and we're giving them their privacy and we're doing the things we can do. Isolation is one big sign. And then when for spouses, you can say that they're probably not enjoying intimacy with you. The pattern is changing. And some people got into this thing before they even got married. So the spouse might not even know there's been a change, because it might be the standard behavior. But the thing is, are they having weird demands during intimacy? Like, okay, you have to do this way, you have to do that. Seems to be unreal. Are they getting more aggressive when it comes to intimacy? Are they, like, there was this a talk that I had men talking about the issue of pornography and how to help. And one of the things that they're talking about is that pornography make men think that, or assume that, women want to have sex in a rough way, that they just want to have it rough, maybe like what they're seeing. So in with spouses or partners, are they having weird demands? Are they having unusual demands? Are they getting less dissatisfied? Sometimes some people are even having erectile dysfunction because they are no longer attracted to reality. They want that super human thing that they're seeing. So it's affecting them. So obvious signs you can see, number one red flag is isolation. They start withdrawing, wanting to be alone. Or you see them getting excessively obsessed about their device. They do not want you to see it or watch it. You know, I told you there are groups that I've been involved with that I hear that I'm listening to teenagers talk about this thing. And one of them said, the first time I saw it, I was doing something on my teacher's device. He was doing something on his teacher's desktop and something popped up. He got curious, wrote the name of what he saw down, got home and tried to search it. And then that was how we started getting more curious. The exposure happened, the satisfaction, the increased tolerance, and then the step went on and on to the point where they depend on it. So another one is, weird or, obsessive protection of their devices. But isolation is one very big red flag. Okay, what was I saying? So we need to acknowledge so that we can support them. We don't trivialize it when they talk about it. Then we don't shame them when they talk about it, and it puts them in a better place to get help. Either your spouse, your child, your friend, your sibling. Acknowledge that it's real. Acknowledgement will make you act in a different way, in a more helpful way. The second thing is the P. The P is, please, you have to partner with them. Partner with them for recovery. Okay, this thing is there. So how can I help you? There are different ways you can help. You're not a specialist. You can't do this, but you can support them. Tell them you're there, rooting for them to be able to get over this. And then you are talking about, do you want to seek help? Do you want to try this? Do you want to wipe your device? I can, put the password. You can be their accountability partner. You can be their cheerleader. You can be the one that they would, call in case they have anything going on, so that you are able to help them safeguard um, relapsing. You can help them search for a specialist to see. You can tell them it's okay to seek help for it. You do things like that, and it would help them a lot. The third thing is, let us support for prevention and protection against relapse. And it is in this support that I'm going to talk about parents, that I'm going to talk about leaders, that I'm going to talk again about mental health awareness, policy changes. Like some countries ban pornography, and I think they're better for it. Even they might have other issues they're dealing with, but at least it is not porn. And it's going to put some things in place for them. So how can we support a friend? We can use the APS. Acknowledge that it's real and don't trivialize what they say. Don't shame them. The second thing is support them for treatment and recovery. The third is, partner with them. Acknowledge, partner, support. APS. Partner with them for recovery. Let me say this here. It is not every mental health professional that can help. I cannot help somebody that is dealing with compulsive sexual behavior disorder. We need specialists. Search for specialists that can help. And there are specialists. They might not be a lot, like you have all we other regular ones, but search for a sex addict therapist, a specialist to help. You can do that for your friends. Search for them, and find a way to be able to just let them get the help they need. So this, like I said, is just barely scratching the surface of this topic, but now we are aware that it is a problem people are going through. And I'm also using this episode to say, The stigma that we have with mental health is preventing people from coming out to seek help. So let us do our best to not make this worse by doing the APS that I spoke about. So let me see. Hello, always a delight joining the session. Thank you so much. Thank you so much. So the people watching, I am grateful that you're able to join live. We're going to continue this discussion in the group. I'll, put some resources that we can use to safeguard. But everything starts from us acknowledging that this is real. For goodness sake, there are people dealing with this issue. And here's what I want to say. Let me say this as I wrap up. For academics, in the academia world, in the medical world, in the professional world, we all talk about, hey, we need the numbers. Numbers don't lie. This, that. Yes, I believe, I agree. It's true. We need numbers to be able to do prevention. We need research to be able to come up with ways to help with treatment. We need all those things. But here's what I want to say. The focus when there's a problem, while we all are working on the numbers to do something, the life of one person that is affected, the family that is affected by this issue, do not really care about the numbers. They just want to be well. They just want their family member to be okay. They just want to be able to help themselves. So please, it is good to focus on the number, but for awareness sake, to be able to make a significant impact to someone's life productivity and to help a family, let us zoom in on the people who are dealing with a particular issue, the people who are struggling, so that somebody's life can just be better for our sake. Let's not just ignore those dealing with stuff for the sake of general issues. So please, every life matters. My mental health matters. What about yours? I'll see you next week. We are moving on to another topic. We have done enough on men for now, and we'll tease out other topics that we should come back to next year. But from next week, we're going to be focusing on armed forces, our military people, our veterans, family of those that are working in forces, in armed forces. We zoom in on them and shine the spotlight on some things they're struggling with. After all, this group is all about increasing awareness and decreasing mental illness stigma. Okay. All right. So thanks for joining, everyone. Thank you so much, Jesba. If you didn't make a comment, I'm sorry I'm not able to see you, but thank you so much for Tabitha. Oh my God, that's my sister from Kenya. Thank you for joining. Facebook user, hello everyone. I don't know your name, but I thank you all for joining, and I'll see you next week. Okay. My mental health matters. What about yours?